This is Dr. Caducci, and I'm here to discuss your cholesterol. You're likely here because your clinician ordered a lipid panel. A lipid panel is a set of tests that look at certain fat-based labs, which include things like cholesterol. So sometimes the phrases may be used interchangeably in a clinical setting. Before we get into what these values actually mean, it's important to know what cholesterol is. Although it gets a bad reputation, you actually need a certain level of cholesterol in order to create your hormones, digest and absorb fats and vitamins, and to make your cell membranes. The body typically packages and transports cholesterol in lipoproteins, and this lab looks primarily at two main particles: the low-density lipoprotein, LDL, the so-called bad cholesterol, and the high-density lipoprotein, HDL, the so-called good cholesterol. Although there are other categories, these are the two that we will use to simplify the concept. You can think of these transports as being vehicles that move the cholesterol from one place to another, with the low-density lipoprotein going through blood vessels being like a low-occupancy car that's going on the freeway. If you need to transport cholesterol from one place to another, you very quickly get into a traffic jam. However, if you have more HDL, it acts as a high-occupancy vehicle, like a bus, which can get to the cholesterol there while improving the traffic flow. Too much LDL in the bloodstream helps create a harmful cholesterol-filled plaque that grows inside the arteries. Such plaques are responsible for angina, chest pain with exertion or stress, heart attacks, and some types of strokes. Some ways to help prevent this include not smoking, improving diet, reducing alcohol consumption, increasing exercise, and if your clinician feels it's indicated, starting medication. Triglycerides are a common type of fat in the body, which helps store excess energy from your diet. It's often combined with high LDL cholesterol or low HDL cholesterol to increase risk of buildup and a hardening of the artery walls called atherosclerosis. This increases blood pressure and is the underlying mechanism of the cholesterol-related medical issues discussed previously. Please remember, this information is not all-inclusive, and an important part of medicine is to look at the whole body, so all values are taken in context of one another. For more information on specific lab tests, a good resource is labtestonline.org. Thank you.